morning. I am Jeannah Balindong, Polao, a third-year nursing student from the Davao Doctors College, BSN 13D Group 16. Okay, so today I am going to perform a return demonstrations about BLS or Basic Life Support. A basic life support refers to the type of care that the first responders, healthcare providers, and public safety professionals provide to anyone who is experiencing a cardiac arrest, respiratory distress, or obstructed airway. It requires knowledge and skills in doing cardiopulmonary resuscitations, using automated external defibrillators, and relieving airway obstructions in patients of every ages. Okay, now let's proceed to the procedure. Okay. In doing a basic life support, the first thing that you're going to do is to check the scene and the victim. You are going to make sure that the scene is safe before doing anything to the victim to prevent any accident or danger. Then after that is you are going to check the consciousness of the victim by tapping the shoulders and shouting like this. Hey, 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 sir, are you okay? Are you okay? Can you hear me? Are you okay? Just like that. Then if the victim is not responding, shout for help. Anyone, hey you, please call 911 immediately. Just like that. Then if there is no people around, you can call 911 by yourself, then wait for the 911 until they arrive. Then stay by the side of the victim and perform the basic life support. Then the first thing that you're going to do is you're going to check the pulse and the breathing of the victim. In doing that, you're going to open the airway of the victim by doing a head tilt, chin lift. Then you're going to place your ear more closer to the victim's mouth to hear the breath sound, just like this. Then look at the chest for the rising and falling so that you can determine if the victim is still breathing. At the same time, you are trying to feel the carotid pulse of the victim for no more than 10 seconds. Okay. So, no pulse, no breathing, the victim is in a cardiac arrest. So you're going to activate the emergency response system or send an AED. Anyone, hey you, can you please send an AED here immediately? Just like that. And if the AED is not available, you're going to wait for the 911 until they arrive, then perform a high quality compression. Okay, in doing chest compressions, you are going to interlace your hand like this, then put the heel of your palm at the lower half of the sternum to avoid any injury, like this. Then keep your hand straight and lock it so that you can give a hard pressure while doing the chest compressions. So you're going to do is to give 30 compressions in no less than 15 seconds or no more than 18 seconds. Then you're going to compress the chest for at least 2 inches depth or 5 centimeters. Then completely recoil the chest in each compression. Okay, so let's do 30 compressions. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 20. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 30. Just like that. After giving a chest compressions, you're going to give a 2 breath to the victim using a barrier devices. But when you are in a public and you don't have any barrier device, you can still give an air to the victim by blowing some air over the mouth of the victim. So, in giving a breath, you're going to give the breath over 1 second. Then the visible chest will rise in each breath. So you're going to do the head tilt, chin lift, then blow. Then blow again. Then just like that, then resume the compressions in no less than 10 seconds. Then you are going to perform again 30 compressions and 2 breaths. Okay. So when the AED is now available, so assuming that this is our AED, first first thing that we are going to do is to turn on the AED. We're going to turn it on. Then correctly attach the two patches. So first patch is I'm going to put it at the upper part of the chest here. And the second patch is I'm going to put it at the lower part of the chest or in the apex part here. Then after that is we're going to clear for analysis. Then clear to safely deliver a shock. So everybody clear and make sure not to touch the victim. Then deliver a shock. Okay. Then if still no pulse, no breathing, perform or do another 5 cycles, 30 compressions, and 2 breaths to the victim. Then if you have a partner, you can switch rules for every 20 minutes or after 5 cycles, because doing a chest compressions is so very tiring. So you need to have a energy while doing the chest compressions to the victim. So and also practice a good you're going to practice a good team dynamics so that you can perform an effective basic life support. So that's all for my return demonstrations. Thank you for watching, and always remember, in Davao Doctors College, we value life.